This is a special edition of Channel 2 News with Ariana Bennett, sports with Garrett Dearborn, and Mike Alger's Pinpoint 2 forecast. This is a special edition of Channel 2 News with Ariana Bennett, sports with Garrett Dearborn, and Mike Alger's Pinpoint 2 forecast.
fires to granting permits to use the land and protecting the animals that live on it. Now, the state director for the BLM, John Roos, is here to talk about all of that with us. John, thank you so much for coming on the show.
You bet, thank you.
Okay, now conventional wisdom is that 87% of Nevada is BLM land. Is that an accurate figure?
It's a little high on BLM. There's federal lands, about 87% of federal land in the state. BLM manages roughly 48 million acres of surface lands in Nevada and about 59 million acres of subsurface minerals.
That's a huge amount of land to cover, though. I mean, really, I think I heard that you could fit all of New England in the amount of land that the BLM manages in Nevada. Is that a challenge for the department?
It is a challenge. It's a lot of work. We have a lot of folks on the ground. We've got 6 district offices. We've got 14 field offices, roughly 1,000 personnel, including firefighters. So it keeps us busy trying to cover the country and take care of the things that we need to be responsible for.
Right. Now, BLM is primarily funded federally, right?
Correct.
And there have been some pushes recently to have control of that land given back to the state. Is that something that is even feasible? I mean, the amount of money it takes to take care of all that land, is that feasible to control it on the state level?
You know,
Coming up on Face the State, from Burning Man to Burning Forest, the BLM is in charge of managing events and issues all across our state. We'll speak with the state director about big things happening on our public lands. Then, Planned Parenthood is once again in the spotlight, with opponents calling to defund it. We'll find out how that would affect Northern Nevada's clinic when Face the State starts right after the break. Welcome to Face the State. I'm Ariana Bennett. Thank you for being with us. Well, Nevada is the 7th largest state in the nation, with huge amounts of land between cities and Coming up on Face the State, from Burning Man to Burning Forest, the BLM is in charge of managing events and issues all across our state. We'll speak with the state director about big things happening on our public lands. Then, Planned Parenthood is once again in the spotlight, with opponents calling to defund it. We'll find out how that would affect Northern Nevada's clinic when Face the State starts right after the break. Welcome to Face the State. I'm Ariana Bennett. Thank you for being with us. Well, Nevada is the 7th largest state in the nation with huge amounts of land between cities. And although that land might not be settled, it is anything but ignored. Now, the Bureau of Land Management is in charge of most of it, everything from preventing and fighting fires to granting permits to use the land and protecting the animals that live on it. Now, the state director for the BLM, John Roos, is here to talk about all of that with us. John, thank you so much for coming on the show.
You bet, thank you.
Okay, now conventional wisdom is that 87% of Nevada is BLM land. Is that an accurate figure?
It's a little high on BLM. There's federal lands, about 87% of federal land in the state. BLM manages roughly 48 million acres of surface lands in Nevada and about 59 million acres of subsurface minerals.
That's a huge amount of land to cover, though. I mean, really, I think I heard that you could fit all of New England in the amount of land that the BLM manages in Nevada. Is that a challenge for the department?
It is a challenge. It's a lot of work. We have a lot of folks on the ground. We've got 6 district offices. We've got 14 field offices, roughly 1,000 personnel, including firefighters. So it keeps us busy trying to cover the country and take care of the things that we need to be responsible for.
Right. Now, BLM is primarily funded federally, right?
Correct.
And there have been some pushes recently to have control of that land given back to the state. Is that something that is even feasible? I mean, the amount of money it takes to take care of all that land, is that feasible to control it on the state level? You know,
I really can't speak to that. You know, each state would have to make that case on their own, and they'd have to determine whether or not they could. There's revenue generated by the minerals that are in the subsurface. There's permit fees that we get. There's, you know, so there is money coming in that would help offset the costs. But I can tell you that nationally we don't make enough money with the public lands to, you know, cover management from the state level. It would also take some extra.
Right, right. And there's a lot of stuff on that land. A lot of it looks empty, but it's really not empty. Lots of animals, and you hear often about things like protecting the greater sage grouse. I know that's a really big effort federally and here on the state level. What is the BLM doing right now to protect the greater sage grouse?
Well, we're in the planning process. We're at the tail end of a 4-year massive push to develop some land use plan amendments nationally. Here in Nevada and Northeast California, we've kind of identified roughly 17 million acres of sage grouse habitat that we're focused on. This priority habitat, we're developing mechanisms for how we make adjustments or determine use allocations for that area. Again, we're at the tail end of that. We've just gone through a governor's consistency review on the planning process. And our next stage is actually the decision stage. So we're getting close to the end.
Now, what's the ultimate goal, I guess?
Well, the goal obviously is to take care of the sage grouse and the sagebrush ecosystem. That's the primary purpose. The push for this was because the Fish and Wildlife Service has been looking at the bird to determine whether or not it warrants a listing as a threatened and endangered species. And so another goal is to make sure that we don't have to have the bird listed in order to ensure protections.
Now, for those who aren't familiar with the issue, can you give us the reasons why we don't want the bird listed?
There are many economic reasons, and I think probably the biggest reason is that means that our natural resources aren't in the proper place in order, I guess. Ecosystems require all sorts of interrelated actions, and so if we have a species that we've determined isn't living the way it should be, that we don't have the populations that we should have, then that means that we've got something wrong in the entire ecosystem. And so this then is a way for us to adjust that, to fix that, and make sure that we're taking care of the entire ecosystem, which in this case includes that bird, the sage grouse.
It's also further oversight too from the federal government. I mean, when you have an animal listed, that's more oversight from a lot of different agencies, making sure that the animal is, doesn't go extinct. And I know that there are concerns from, people who want use of that land for other things, right?
Well, it restricts it in some areas if an animal is listed. We have lots of different hoops we have to go through. We have to work with the service. We have to go through a Section 7 consultation process to where we write a biological assessment, which then they look at that biological assessment and give us back opinions on whether or not the plans we've put in place will protect that species for the project that we're looking at. So it takes a lot longer to get a project permitted, and oftentimes we can't permit things because we can't provide the protections necessary.
Right. Yeah, definitely makes sense. How are you feeling about the progress so far, though? Are you feeling optimistic that we're going to be able to prevent that listing?
I'm very optimistic. I think as you look at the planning process, you look at the cooperation, the collaboration that's been done between the state governments across the West, the federal agencies, BLM, NRCS, U.S. Forest Service, and the Fish and Wildlife Service, I think we've made great strides, and I think we have a lot of the tools that we need in order to ensure that the bird doesn't get listed, that it's not warranted for listing. And so then, again, the next part of it is we work with the state agencies, the wildlife agencies in each of the states to make sure that we're managing that animal on the ground correctly.
Okay, and other animals that you guys have to manage, I know wild horses are a big one, especially this time of year when it's hot outside. Is the BLM doing anything differently this year to manage our wild horse population?
Well, we continue to look for new tools to help us suppress the population growth. We've got several new testings going on with the USGS, and they're looking at multiple fertility control methods, both physical fertility controls as well as drugs that will help us in turn suppress the population growth so that we don't have an 18 to 20% population growth every year.
Why don't you want that?
Well, because we don't have the rangeland capacity that will allow us to expand the herds any larger than they are. You know, again, as you talked about, there are other animals out there, there are other uses that are out there, and so, you know, we have to provide for all those uses as part of our main mandate of being multiple use. So to have one animal that's having a precedence on the range, you know, that makes it difficult for any other uses to occur.
Right, makes sense. Okay, switching gears a little bit, I want to talk about Burning Man, which is pretty much upon us at this point. The BLM did approve their land use permit for this year's event, kind of in a last minute thing. I mean, it came out in early August. Why was that such a late in the game announcement, this permit?
Well, really it wasn't a late in the game kind of announcement. That's kind of on par with some other years. We had some hiccups in our process this year, but by and large, we have a great working relationship with Burning Man Corporation, and the BRC and BLM really have done a great job of collaborating and finding ways to be efficient with the activities on the ground. That organization does a fantastic job with the after the event work that they do to ensure that the public lands are restored back to the same shape they were when they start the event in the early part of the year. So it's actually, again, I've got to give them kudos for the extra work they go to make things right at the tail end of the event.
Even given that, though, it's a complex thing, I imagine, to issue the permit for this because it's such a massive event with so many different elements to it. What is the process like creating that land use permit and the rules that are going to go along with it?
You know, it is almost hard to describe because it is the largest event that we have on public lands for the BLM. There are 70,000 ticket holders that go to that event, and then there are volunteers that work out there. There are federal agency folks that are out there, county folks that are out there. So there's a lot of people on the playa. We go through all sorts of, we've got to publish the permit in the Federal Register notice, the stipulations we put on it. We have mitigation criteria that we put out, and we work together with Burning Man to come up with what those are so that we aren't being too extreme in what our requests are. So in the end, it's a long-term process. It's a difficult process, but there's also then we have to look at the cost recovery dollars that we get in order to process the permit. And so that takes a while to figure out what those numbers come up to and calculate, what our needs are in order to process that permit. And then a little subnote on that is that while there's one large overriding permit, there are multiple vendor permits that are underneath that. And so we have to do the same process, you know, a whole lot of other times, you know, roughly anywhere from 70 to 90 sub-permits that are out there. So we've got people on the ground monitoring those individual permits as well as the overarching permit.
That's a big undertaking, absolutely. Those people that you have on the ground, will they also be enforcing things like the drug and alcohol policy that the BLM kind of stipulated in its use permit? We have
a component that does the law enforcement part of it, and then we have an operational component that looks at the natural resources, at the sanitation and the environmental concerns that we have on the ground. So there are two components, but they work hand in hand. At the same time, BRC has the same group with us, and so that we work together on all those fronts to make sure that we're all seeing the same things.
Okay, and so the rules, people can expect them to be enforced, or is it a little bit more lax?
Rules need to be enforced. I mean, and that's why we put them on paper. That's why there's stipulations on the permit, and that's what our job is.
Okay. Now, another big part of the BLM is obviously the firefighting and fire prevention efforts. I know you've got a lot of that going on right now. Tell me about that.
Well, this year, Nevada BLM has been fairly fortunate. We've had roughly 450 fires statewide, and on the public lands, on the BLM portion of it, we've only had about 35,000 acres burned. So BLM Nevada has done pretty well. We've been very fortunate. The rains that have come through, the lightning that's come through has had rain with it, and so that's kind of minimized the impacts to our public lands. Nationally, we've burned, not just BLM, but all the agencies, about 7.5 million acres nationally. Over 5 million of that is in Alaska. So Nevada BLM is, like I said, we've done really well. But that doesn't mean that we aren't continually trying to make sure that we're prepared, that we look at the weather forecast, we look at the conditions that are going to be that are going to come at us in the future. We try to pre-position resources. We take advantage of everything that we've got. We've got roughly 50 fire engines in the state. We've got 4 helicopters, you know, and other resources. But our job from the fire staff is to pre-position those resources. We work closely with the Forest Service. We work closely with NDF, and it's a collaborative process constantly. The volunteer fire departments are also a big part of what we, you know, help us achieve our goals at the end. One of the things that we're going to have.
Sorry, John, I'm actually going to have to cut you off. We are running out of time,
okay.
But I really do appreciate you coming on the show. I apologize. I really hate to cut it off. Really interesting discussion, but thank you so much for your
bet.
time.
Thank you for having me.
It.
You bet.
Now, coming up on Face the State, Planned Parenthood is in the news once again, facing opponents who want to take away its federal funding. Hear how that would affect our local Planned Parenthood right after the break. Welcome back to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, after a video went viral online featuring a Planned Parenthood doctor appearing to admit to selling fetal tissue, the organization has once again come under fire, with some calling to have its federal funding taken away. So I wanted to know what impact that could have here on the local level. Elisa Caparato, the president of the Nevada Advocates for Planned Parenthood Affiliates, is here now to talk about that with me. Elisa, thank you so much for coming on the show.
Thanks for having me.
Now, controversy is really nothing new for Planned Parenthood. That's something that, you know, it sees nationally. Is it something that we see here locally as well?
Well, you're exactly right. This particular group that released the video has been working on these kinds of projects for well over a decade, so we've seen this sort of thing before. In northern Nevada, we currently have one health center, and they currently do not provide abortion services, so it's entirely preventive health care and education. Sometimes our opposition understands what services are provided, and sometimes they don't. But we don't see a lot of protest activity. We are seeing more in Nevada with some of the legislation that we saw this session. It's all political, and it has very little to do with the actual services that we provide.
So when northern Nevada women are seeking abortions, where do they go if not Planned Parenthood?
There is another private provider, and often they will leave the area, which is, what a lot of women have to do. Most women in Nevada and across the country live in a place that doesn't provide abortion services, so pretty much it's a service that women have to travel for.
Right. Okay, so if not abortion, what services does Planned Parenthood provide here?
Well, just like almost all the other healthcare centers across the country, basically what we provide is mostly preventive healthcare services. So we provide well women checks, cancer screening, cervical cancer testing, sexually transmitted infection tests, and also treatments. We do physical breast exams. We generally don't do mammograms unless we have a grant to have the mammo van come and visit. And in addition to those kind of preventive services, what a lot of folks know us for is birth control, which makes us the #1 healthcare provider that helps reduce the number of unintended pregnancies and therefore abortions. And the other large part of what we do is education services for young people, families. We even run parents' workshops to help parents talk to their teenagers about sex.
What's the cost difference between seeking those services at Planned Parenthood versus seeking it at a more typical healthcare provider, going to a doctor, going to a clinic?
I haven't looked at the exact cost difference, but pretty much we're a mission-driven healthcare organization. So we're part of the safety net, and we make sure that women can get access to the care that they need. Mostly we do it on a sliding scale, so depending on your income, we can help provide those services a little bit more affordably. And also we tend to be very patient-centered, so we will make sure we work with particularly young women and young men, teens. For example, birth control, you can get birth control through the mail and have a monthly debit withdrawal to cover that, so that you don't have to come up with all the money up front.
Is it typically less expensive to do it that way?
Well, we try and keep the prices low, and so that would be for someone who didn't have insurance. One of the great things about the Affordable Care Act is for people who have jobs or are getting insurance through the Affordable Care Act, birth control and their annual well women exams are covered as part of the preventive screening. So they're not free. I'm always resistant when people say that, but as part of your premium that you pay every month, which can be $50, a couple $100, those preventive care services that really keep you healthy are covered in that. So for a lot of women, that's been the biggest advance in affordable access to care that they've gotten, that we've seen ever in this country. It's been a great advance.
Right. Now, Planned Parenthood's obviously been in the news for this most recent video surfacing talking about the fetal tissue donation program. Mm-hmm. Is that something that our local affiliate participates in?
So the health centers in Nevada, none of them provide that service. It is something that is only provided in very few of the health centers around the country, and it's been mostly in response to women who have asked for that service, and we provide it in the exact same way any other high-quality healthcare provider would provide it, but it is not a service that's available in Nevada.
So asking for that service meaning they want to donate?
Right. Oftentimes women will end up with a pregnancy that they would like to carry to term, but there is a problem, a severe fetal anomaly, a risk to their health. And so, in those cases, we want to honor the wishes of the patient, which is the way we always provide health care. If they're not able to continue a pregnancy that they really want to carry to term, this might be some way for them to give back or to find some meaning in a situation that is really a tragic situation for a family that is in a position that they don't want to be in. So,
and the tissue goes to research or to anything else?
I really can't speak to the specifics of it because we don't offer that service here.
Okay.
So,
have you had a lot of people thinking that that the Nevada affiliate does, and have you had issues or have you heard from people?
I haven't talked with the health centers You know, as far as I know, it has not come up here. So it's interesting because this is life-saving research. It's research that's been used to look at treating diseases like Parkinson's or cancer. And so what's been interesting about this whole process is it started a conversation about this life-saving research. And the other interesting part about that is the political conversation has nothing to do with that. The political conversation has really been in Congress. This is just another excuse to earn some political points. So we're going to talk about defunding the preventive services that Planned Parenthood provides.
I want to get away from politics a little bit and just talk about the specific services. So should defunding the program happen? I mean, I know currently federal dollars don't go to fund abortion services at Planned Parenthood. If defunding were to happen federally, what would happen here locally in terms of the services you could provide?
Okay, so what happens is Planned Parenthood sees about 22,000 women a year, patients. They get very little federal or state dollars. The only dollars that come to our health centers are in exchange for healthcare services, just like any other provider. So if you go to a doctor, the doctor will provide services and bill for that. So in Nevada, we only take Medicaid in our Reno health centers. So there's a very small federal component reimbursement for that, and then mostly it's federal dollars. And there are some Title X family planning dollars that we might get for providing a pap smear, a breast cancer screening, you know, birth control, something like that. But those are very, very limited dollars.
So services wouldn't necessarily go away if federal dollars were to stop?
So, right, people say, well, would Planned Parenthood go away? No, Planned Parenthood will still be here. What will go away are the services and the access for the women who most desperately need it, the lowest income women who rely on Medicaid or a grant program to get that care. They don't have insurance. Those are the women who would be denied these services. And you see in places like Texas where they stop providing family planning is that then, you know, what happens when women don't get birth control is then they get pregnant, and then that's a much bigger cost to the state. And so Texas actually reversed its decision to stop funding family planning because it's a very short-sighted, unhealthy response to dealing with half of your population.
Okay, now for those women who couldn't then afford services, is there any other recourse? Is there anywhere else locally where they can go and get those services, or is Planned Parenthood it?
Planned Parenthood is a major provider, and we are the provider of choice for those women who come to see us. There are a few other options, like the District Health Department, for example, hopes when they finish their expansion will see a few of these women. There are, for example, the Pregnancy Center at Renown does handle low-income women, but that's if you've gotten pregnant. If you don't want to get pregnant, that's not a resource for you. So there's already a provider shortage in Nevada. We're very short on safety net, so Planned Parenthood does play a very critical role for a large number of women in our state.
Okay, now we've got about a minute left. I mean, if there's one message that you would want to give people about the services that Planned Parenthood provides, what would that be?
I think you would be surprised. What we provide is preventive health care. We are trying to keep women, men, and teens healthy, and you know, and we really would like it just to be a conversation about health care and not a political conversation. We're with you on that.
Absolutely. Okay, is there anything else you wanted to add before we go to break?
That's it. Thank you.
Elisa Cafrata, thank you so much for your time. I do appreciate it.
Thanks for having me.
Well, that is it for this episode of Face the State. But for more information on all of this or to see past episodes, just head to our website, ktvn.com. Thank you for being with us. We will see you next week.